Recently, medical marijuana has become a hot topic and is stirring controversy all around the world. Is marijuana appropriate to use for those who are sick and in need of an answer? If medical marijuana is legalized everywhere, will it become a mass drug problem? There are a lot of questions that arise with this topic, as well as controversies about whether medical marijuana is an ethical issue. Legalities come into play of whether medical marijuana is in accordance with the law. Many negative aspects surface when the subject of medical marijuana arises. However, there are a lot of positive research that shows how medical marijuana can be beneficial. Researchers have provided evidence that medical marijuana is giving those who are terminally ill hope. People who are suffered from pain for many years are receiving comfort from trying medical marijuana. Some children who have severe medical issues can obtain some relief from the use of medical marijuana. There's a lot of information that comes into play when looking at both sides of this topic. The real question is whether medical marijuana should be used, and does it really help people who have major health issues? Recently, there has been a growing number of states who are legalizing medical marijuana for health reasons. There are people all around the world that believe that marijuana is the cure to all health issues. One recent article displayed that recent animal studies have shown that marijuana extracts may help kill certain cancer cells and reduce the size of others. The article goes on to say, evidence from one cell culture study with rodents suggests that purified extracts from whole plant marijuana can slow the growth of cancer cells from one of the most serious types of brain tumors. Research in mice showed that treatment with purified extracts of THC and CBD, when used with radiation, increased the cancer-killing effects of the radiation. According to the same article, marijuana and its extracts are treating symptoms of illnesses such as HIV and AIDS, multiple sclerosis, pain, seizures, and mental disorders. This diagram shows you how CBD and THC helps with those subjects. CBD is known to relieve pain, suppress appetite, weight loss. It kills and slows bacteria growth. It reduces blood sugar levels, reduces vomiting and nausea, and the list goes on. In 2018, the FDA approved Epidiolex, oral solution for the treatment of seizures associated with two rare, severe forms of epilepsy. Medical marijuana has been shown to help with some medical-related issues. However, the question remains of whether people are just using medical marijuana for the high. According to Peter Grinspoon, the extract of the hemp plant known as CBD, this component of marijuana has little, if any, intoxicating properties. He stated that CBD dominant strains have little or no THC, so patients report very little of any alteration in consciousness. Many of these articles present a great depiction of how medical marijuana can play a positive role on health. However, there are many scientists who are stating that medical marijuana comes with its fair share of negatives. Medical marijuana is known for reducing the amount of nausea that coincides with cancer treatments, decreasing seizures, and helps to control pain management. However, there are certain negative aspects of this drug that people are not seeing. Kristen Ware stated in an article that she wrote that at the University of Barcelona and colleagues reviewed 43 studies of chronic cannabis use in the brain. They found consistent evidence of both structural brain abnormalities and altered neural activity in marijuana users. Findings from those studies suggested that both structural and functional brain changes emerge soon after adolescents start using this drug. Some of those brain abnormalities have been linked to cognitive differences. Gruber found that regular heavy marijuana users, those who reported smoking 5 of the last 7 days and more than 2,500 times in their lives, had damage to their brain's white matter and gray matter. And this diagram shows you a depiction of where marijuana affects the gray matter in the brain. You can show the decreased amount that it shows here. This also shows how a non-user, how much gray matter is shown, and then with users that use marijuana. So, those white matter changes were correlated with higher impulsivity, and she found particularly in people who began smoking before the age of 16, not only had medical marijuana been known to affect the white matter in the brain, but it also is causing major issues within people's respiratory systems. As marijuana dispensaries experiment by breeding out different cannabinoids in order to increase the potency of THC, there are many unanticipated negative and lasting effects for individuals who smoke these strains. The crude marijuana plant and its products may be contaminated with fungus or mold. This is especially problematic for immunocompromised patients, including those with HIV and AIDS, or even cancer. These are just some of the problems that medical marijuana produces. I believe the biggest problem and question that comes into surface when medical marijuana is discussed is whether it would increase drug addictions. Research suggests that between 9 and 30% of those who use marijuana may develop some degree of marijuana use disorder. People who begin using marijuana before the age of 18 are 4 to 7 times more likely than adults to develop a marijuana use disorder. According to another article, it states that a withdrawal syndrome has been described consistently of anxiety, restlessness, insomnia, depression, and changes in appetite, and affects as many as 44% of frequent users, contributing to the addictive potential of the drug. This addictive potential may be less than that of opiates, but the belief, especially among adolescents, that the drug is not addictive is misguided. Medical marijuana presents many good qualities, and some that are bad. The question remains, should we use forms of cannabis to help with medical issues? In my opinion, I believe that medical marijuana should be used for those who really need it. There are many negative side effects that can come from this. However, I believe that there are many benefits that can help those in need. I work with many special needs children who suffer from major medical issues. I've seen some children who have been given the chance to partake in forms of cannabis. These children were able to receive some form of relief when their parents thought there was no hope. Not only did it help decrease some of the medical issues that were at hand, it changed the whole demeanor of the child. If medical marijuana is to be used for a person's treatment, then it should be monitored closely. I also believe that it is a case-by-case situation. Medical marijuana should not just be a handout for recreational use. It should come with some very light stipulations. And while I believe that there are many negative aspects that come into play with this form of treatment, I also believe that it can really help those who need it. I believe that the positives outweigh the negatives, and that this form of treatment can really help them.